Hello guys, it's Mark at Lismore House Dental Practice here. Hope you are all doing well. I'm just going to have a chat to you today about things that I think you should consider before embarking upon cosmetic dental treatment, whether that's something simple like just a little bit of composite edge bonding, or whether it's something more comprehensive like a full smile makeover. So I'm not chatting today about the actual clinical work. I'm just chatting to you today about a few things that I've thought up that I think you should give some consideration to before, deciding to go ahead with treatment. So the first thing is the credentials of the dentist, credentials and experience of the dentist. So when you choose to have some cosmetic dental treatment done, make sure that the clinician that you choose is adequately trained in the procedure they're going to do on you. So make sure they've done extra training in cosmetic dentistry, and make sure that they are experienced in cosmetic dentistry. Can they show you some examples of befores and afters of the sort of treatment that you intend to have done? The second thing to consider is referrals. By that I mean, if you see somebody who's got a beautiful smile, have no shame in complimenting them on it, and ask them if they've had any work done, and if they have had work done, who did it, where was it done, were they happy with it, were there any pitfalls, is there anything they would have done differently? So that could be someone online, it could be someone that you follow on Instagram or Facebook, it could be a friend, a colleague, a family member, but I always think that person-to-person referrals are the best. The next thing is cost. So cost is always a consideration, whether that's buying a car, a new sofa, or getting dental treatment done. It's a fact in a capitalist economy that money comes into decision making. I think it's wrong to have cost as the number one thing, but it should take a place. You should really be thinking of other things first. So quality of treatment, communication of the dentist, just the whole experience, referral. Make sure that you're picking a dentist that knows what they're doing, that's good at what they're doing, that's going to do it in a caring manner, that's in a nice environment. But cost obviously does play a part in that. Now research the clinician, make sure that they are trained and skilled and that they get good reviews. So look up Google reviews. If they have an online presence, look up any befores and afters, ask around, and also research the types of treatment that you can have done. So be familiar with what a veneer is, what composite bonding is, its limitations, its the benefits of certain treatments. Minimally invasive dentistry. I always try and steer people away from getting sort of Turkey style dentistry when you just prep every tooth. Often we can avoid that. There's been quite a revolution with adhesive dentistry, and we can often do very, very minimal treatments for maximum effect. Seek full clarity from the clinician, so make sure that you're asking all the questions that you want answered. It's not a bad idea to write things down, so come in with a list of questions that you want answered. Make sure that dentist is happy to chat in depth with you. How long is this treatment likely to last? What will the appointments involve? How long is it going to take to get this treatment done? What's the cost? And if it doesn't work, what can we do? Communication skills are key as well. So that kind of falls into the last point as well. But you want a dentist that you can establish a degree of rapport with, that you feel comfortable with, someone who can communicate clearly to you, that's not speaking in jargon. You want somebody who can put things into terms that you understand. So communication skills are key. Communication is key to achieving what you want, and communication can be visual as well as verbal. So can the dentist do a computer mock-up? Can they do a chairside mock-up so that you can communicate, no, I don't want them quite like that, I would like my teeth a bit longer, is that possible? There should be a massive degree of predictability in cosmetic dentistry. You should know exactly what you are getting before you get it, and then it should be delivered and you should say, yep, that is exactly what I wanted. So communication is key. And at Lismore House, we are part of the Pain-Free Dental Group. We pride ourselves on the whole patient experience. So if you're going to embark upon cosmetic dental treatment, you'll come to the practice for an initial chat with Sarah, our treatment coordinator, very informal. You'll meet with her, she will chat through various options with you. There's tea, there's coffee, sadly no alcohol available, kind of nulls the consent process, but we've got a nice waiting room. It's a lovely building that we work in. I'm fortunate to work here. We really focus on patient experience. The front desk are very friendly, the nurses are well trained and they will look after you well. The dentists, we're all trained in pain-free techniques, so you're going to have a pain-free, pleasant experience. We get a lot of patients come to the practice who have previously been scared of dental treatment, they've had some bad experiences, and it's amazing to see, you know, their experience turn around, and that is the patient journey that does that. You know, we really focus on your care at Lismore House, so make sure if you're getting cosmetic dental treatment done that you're not just buying a product, you're buying into that whole practice, the patient experience, the patient journey, you know. So yeah, I could waffle on all day, guys, I'm afraid, but that's just a few things that I was thinking up to really consider if you are planning to have some cosmetic treatment done. And like I say, that could be full veneers, it could be some Invisalign type treatment, it could be just a little bit of whitening, a little bit of cosmetic bonding. So I look forward to seeing you guys in the future. All the best.